right, well, many of us love our hot wings, our French fries, that big bowl of spaghetti, but all these foods can trigger a fiery and uncomfortable case of heartburn.
Joining us now, board certified general surgeon Dr. Garrett Peel from the Previty Clinic to explain some options for fighting the burn. Dr. Peel, good morning.
Good morning.
Good to have you in, as always.
Good to be here. Good to be here.
All right, well, let's talk about heartburn. A lot of us, this is just an occasional thing. It's not an every day or all the time thing. How do we handle the occasional heartburn?
Well, heartburn impacts everyone because the stomach is connected to the tube that is connected to our mouth called the esophagus.
Right.
And there's a little valve there that can open, and bile and acid can basically reflux into that esophagus. And so that's what causes the burn. The key is food that we eat can usually cause heartburn.
Sure.
So stopping the food in the short term that triggers that is most important.
But what if it's your favorite? Then you know.
Well, then you limit it, you know,
Okay.
and you pop an Nexium that's
Yeah,
just
exactly.
approved. Yeah. But the issue here is if this goes on more than 14 to 21 days, you need to seek help from your primary care doctor or your GI doctor, because long-term heartburn is dangerous. And in fact, we know that esophageal cancer is on the rise in this country. And esophageal cancer can be prevented by treating reflux disease into the esophagus from the stomach. And we see that essentially the stomach makes acid, right? In fact, it's very low pH, so that it can digest and break up all of our food. And there's a little sphincter there called the LES, and that LES is usually tight. But some foods create it to be loose. And then some patients have a propensity for that LES to be loose. And so over time, more reflux happens, and the esophagus is exposed to that bad acid that can cause erosion and ultimately cancer.
Yeah.
All right, and for a lot of these people, they know about Nexium because they've had it before, and it helps to treat this. And it's just, as you mentioned, become something that they can get over the counter much easier. Is that a good thing? It's a lower dose, but
the purple pill is
right?
The purple pill is at a low dose, available over the counter, which is a great thing for patients because you can self-treat a small interval of heartburn. However, it takes about 5 to 6 days to work, so it's not going to be an instant fix, and you shouldn't use it over 14 or 21 days, frankly. The key here is that it's a low dose, and so if you have recurrent heartburn, then you need to basically do something about it, get to the doctor, and have yourself evaluated. The fun thing here is that we can stop heartburn in its tracks early by 2 ways. One, we can coat the stomach. Okay, and then also with Nexium, we can stop the pump that makes so much acid. So your stomach will still make acid, but if you're a person that makes more acid than normal, then that small dose Nexium should help.
I've also noticed, for me personally, if I eat something a little spicy too late in the evening during bedtime, I mean, it's pretty bad.
Sure, and think about it. You're going to eat something spicy or eat something that's rich in fat or sugar, any of those, especially caffeine and chocolate, close to bedtime, and then you lay down, and then that sphincter relaxes, and then whew,
there it comes.
There it comes. Exactly. So we've all been there, and it's just part of our human body. But the point is that let's be very careful. Watch and listen to our body. If it is longer than 2 weeks, seek medical treatment, and especially if it's longer than 2, 3 months. Some patients come to our office who have had this for years and don't have any treatment. And with all of the medical help we have now in our community, that's easy, especially if you don't have insurance, because you can go and get a short-term fix over the counter now with the low-dose purple pill.
All right, and speaking of medical options, let's talk a little bit quickly about Stretta. What is that?
So Stretta is a minimally invasive surgery. That means that there are not any incisions to fix heartburn and reflux. The typical way is through small laparoscopic incisions to create a new valve. The Stretta therapy provides us with a way to tighten that valve using a non-invasive approach, using energy, right, through the mouth rather than surgery. This still requires some anesthesia, but it's like having a scope. It's like having an EGD where we go down with the patient sedated and basically deliver energy at certain levels of that esophagus to tighten that valve. And this is a wonderful opportunity for patients who either don't want the fundoplication for heartburn and reflux, or who are not good candidates for surgery, we can treat them in a non-invasive, minimally invasive, incisionless approach.
And does it make it go away completely?
Good data show that about 86% of patients who have this procedure are off their medications within 3 to 6 months.
Oh, wow.
And our experience at Previty is much better. And so we have long-term results over the past several years. Patients just really love this procedure.
To not be able to, or not have to take that every time you eat something spicy.
And then it also tightens that valve and potentially prevents esophageal cancer.
Very nice.
Wonderful.
That's the key. Prevention. All right. Dr. Peel, thanks. Good to see you.
Much. And you want to be sure to tune in next Wednesday because Dr. Peel will be here again and he'll be doing a cool sculpting procedure live right here on the air.
I can't wait for this. Doctor's going to show us how the procedure can help you get ready for the summer.